IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to another episode of All Things Policy. In the last week, we have seen a lot of news about the NFHS5 survey. The report on the findings of this survey was published last week. There's been a lot of talk. A lot of people have given their views on this. In this episode, we try to unpack the main findings of the report, try to see some policy implications for this. Joining me today is Apurva, who is the staff program manager for the postgraduate program in public policy. He researches extensively in the public health landscape in India. Welcome to the show, Apurva.
Hey, thanks, Suman, for having me back.
Let's get straight into the topic. Okay, health surveys and their significance. What are the different kind of surveys that are done? What is the significance of this particular one that we have seen in the last week?
Right. So the National Family Health Survey, I would say the fifth report came out last week. I think these reports were divided into two phases, right? So phase one came out a few months ago, and then, phase two report came, last week. A few states were covered in phase one and more states were covered in phase two. So National Family Health Survey is actually a sample survey. And this is very important, Suman, to understand. This is a sample survey that that International Institute of Population Studies, along with other organizations, they conduct, and they broadly cover some of the health indicators and socioeconomic indicators of India, right? And you will see a lot of women-centric indicators in NFHS, all NFHS reports, right? The NFHS report started in 92 and 93. So first report came in 92 and 93. The second report came in 98, 99. Third came in 2005 and 6. The fourth report came in 2015 and 16 after a gap of around 10 years. And the fifth report came, last week.
Yeah,
that's right. Yeah. So this is National Family Health Survey. Earlier, we used to have DLHS, which is District Level Health Survey. That was a detailed district level reports of health indicators and socioeconomic indicators, and that also used to give a very good understanding of what health indicators are in several districts. That also used to give ideas to public health researchers as to not only interstate disparities but also inter-regional disparities or inter-district disparities within the state. The last DLHS came in 2012 and 13, after which I think they have discontinued. And I think some of the DLHS features has now merged with NFHS, because now in NFHS, you'll get district fact sheets. So in NFHS 4, 2015 and 16, you not only had a national and state fact sheets, but you also had district fact sheets. So now NFHS also does the work of DLHS. So all other indicators they have added in the past few years, and so on and so forth. Right now, only state level, I think district fact sheets have also come out in NFHS5. So I think, it's a huge sort of, treasure trove for researchers and data enthusiasts to take a look at it. So NFHS and DLHS are like sort of sample survey. They are different from census, Suman, because census is kind of an enumeration in which, every household gets enumerated. And we will talk about it later, but census gives a holistic picture than NFHS, although NFHS gives you a direction of where the overall health of the country is going, but census gives you more a true objective and holistic picture of this thing. Apart from that, there are other sort of episodic surveys. So NSSO would come up on consumption patterns with respect to health. I think 75th round was around health. As consumption within the consumption sort of an pattern report. And then national health accounts also come up with reports on health spending and health finance. So these are broadly some of the reports that cover public health and healthcare in India.
Yeah, so if the census is held once in 10 years, so it would give a more detailed account. So in the interim, I think all these reports fill the gap for necessary information. And so they all have their place in the public, public policy kind of the landscape, right? I mean, we don't want to be dependent on one report that comes out 10 years. First of all, 10 years. And by the time they publish that report, it will be a little longer. So I think all of these reports have their place in the entire ecosystem, right?
That's right, Suman. That's right. And census also covers other things also, rural versus urban, rate of urbanization, right?
Yeah.
And it does a lot of detailed slicing and dicing within each state or within each district.
Yeah. So if we want a more telescopic, we want to zoom in onto a particular topic. I think these, for health, it is this NFHS, whereas for education, it is, the ACER report or any other report that we can get. So, so in that sense, the NFHS is quite comprehensive because now they have expanded their reach and it is, you get everything in one go. So it is an important indicator for us in a lot of ways, right? So the NFHS4 was done in 2015-16. The first phase of NFHS5 was done between June 2019 and Jan 2020. So this is pre-pandemic. So the results of this survey could be colored in some ways because the phase 1 was done pre-pandemic and phase 2 was done, in the midst of the pandemic, Jan 2020 and to April 21. So do you think that will have a bearing on some of the data or findings that we have got here?
I think some of the data reflects this whole lacuna and the gap that you mentioned, Suman. And Ashwini Deshpande in her piece in the Hindu has also written about it, right? So this the number of more female than male. So as per her analysis and as per her understanding, she argues that this could be because of under sort of enumerating male members because they would have gone out for work due to migration or even other indicators such as malnutrition. It shows some sort of an improvement, but especially in phase 2. So in phase 2, all indicators have shown improvement, but in phase 1, the same indicators have not shown the improvement. And Ashwini Deshpande argues that it could be because the enumerators or the surveys would not be able to go out to write people because it's a sample size, right? And the sample size has to represent the larger sort of population, and that could be one of the reasons.
Okay, I would also think that the free grain policy that they came up with, that they were giving out, may have had some kind of an impact on this, but we can't be really sure at this point.
I don't think so, because see, all these take time. So nutrition improvement and everything else, they need time. They need years. They need decades. In fact, generations. So
that's true.
Yeah. The short term we can't assess, but
hunger maybe yes, but not.
That's right. That's right.
Yeah, true. Okay. Going forward, the most talked about finding of this report is the total fertility rate. Just to give our listeners a brief on what this means, it is the total number of children that would be born to each woman if she were to live to the end of her childbearing years. Okay. The total fertility rate of 2.1 is considered to be the replacement rate. That is the rate at which one set of people replace the other set as such. What is the detailed finding on it? How should we read this number? Would you have some kind of pointer for this?
Yes. So as per the latest reports, India has achieved a great milestone, and the total fertility rate, as you mentioned, has gone below 2.1, which is the replacement levels, right? That essentially means that the population is either not growing nor shrinking, but it has stabilized. It has hit its peak. Okay, and it's a classic sort of this theory in demographics and population studies that the population will start increasing, it will hit at its peak, then it will stabilize, or it may sort of start reducing marginally, but there won't be a population explosion or population bomb that we've been talking about.
Yes.
So that is where India is right now. We have stabilized our pop.
Is this across the country? Is this?
No.
There would be regional variations.
Right? Absolutely. So North Indian states, some of the North Indian states like UP, and other states, their fertility rate is still to more than 2.1. Rajasthan, UP, and other states. Southern states have performed really very well. I mean, they have historically performed really very well when it comes to total fertility rate. But the most important aspect is that even though we have our total fertility rate is below replacement levels, the stability in population will come after 15 to 20 years, because this is again, and it's a classic sort of theory within population studies, that the current generation, the current boys and girls, they will sort of they will conceive 10-15 years later, 15-20 years later down the line, right? So which means that the population will stabilize after 15-20 years. So the stability will come after 15-20 years, not immediately, but we have to maintain this total this TFR below 2.1 to achieve that stability.
Okay, so this 2.1 is a national average?
That's a national average.
Okay. So from here, what I see is, we always knew that there is no case for a population control law as such. Okay, it was just, a lot of politicians were just playing on that. And from what we have, the data here, it is clear that we don't need a population law as such. Right?
Not only population laws, Suman, but coercive population laws, right?
Yeah.
Coercive, that takes away the agency of a human, especially women, is just not required. And off late, these all these sort of statements by random politicians and leaders that a certain section of women should bear so many women, it's just atrocious and just inhumane.
Yeah, so the policy implication is clear here. So we don't need a population control law, at least in any form. Coercive, definitely not. Yeah, at this point, I think we should take a break. While we take a break, let's talk about our courses. Okay, for our listeners, the Takshashila Institution is an independent, non-partisan think tank and a school of public policy. We have education programs lasting one semester, which is the GCPP course, and up to 1 year, which is the PGP course. These are all online, and you can take them from anywhere. Admissions are now open for both our courses, the 12-week graduate certificate in public policy, as well as the postgraduate program in public policy. The next cohort begins 15th January. The last day to avail of a 10% early bird scholarship is 4th December, and the application deadline is 8th January 2022. Do visit our website, school.takshashila.org.in, to find out more. At this point, we'll take a break.
Hey everybody, it's been another great week on the IVM Podcast Network. In the kickoff episode of Think Fast, our hosts Varun Dugirala and Suchita Salwan give you their hot takes on all things trending. Whether it's the Paytm IPO fallout, Taylor Swift's re-releases, or the latest season of Shark Tank India, do check it out. On Misconduct, Raghavi and Nisha take us through the story of Santokh bin Jadeja, aka the godmother of Porbandar. At her peak in the 80s and 90s, her gang had over 500 registered criminal cases. Are social networks just content moderating platforms, or are they true blue publishers? Dive deeper into this debate with Siddharth on Smarter with Sid. On Marathi Khidkitun, Dr. Rajiv and Manik Deshmukh talk about differently able people who emerged as achievers. And speaking of Varun Dugirala, this week on Advertising is Dead, he is joined by content creator and gamer myth Path. They discuss his journey as a creator and the experience that came from it. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. And finally, do remember that many of our shows are available on YouTube. You can check that out by going to our website, ivmpodcast.com/YouTube, where we have a list of all of our various YouTube channels. Finally, we'd like to thank the sponsors on the network this week: Cred, Bank of Baroda, HDFC Mutual Fund, CoinSwitch, Kuber, Intel, and Oxfam India. Thank you so much for making this possible.
Welcome back to this episode of All Things Policy. We were discussing the National Family and Health Survey, NFHS5. We discussed the most important, what most people consider the most important finding, which is the total fertility rate. There are a few other things that this survey has actually brought into focus. The other thing that was in the news was the sex ratio, where it said that we have 1,020 girls for every 1,000 men. Now, is that really true? Have we reversed our, the sex ratio? Is that not a problem anymore? What do you think is the takeaway from there?
It could be or it could not be. So the analysis that has come out in the past 1 week, there are several reasons and several dimensions, aspects to this fact. The first fact, as I said in the beginning, Suman, is that this is a sample survey. And this is not an enumeration like census, so household enumeration like census. So when we get census data, I think that will give us a holistic and an objective picture of sex ratio. That is one. B, sex ratio at birth is as an important metric than adult sex ratio, which NFHS has considered, because the sex ratio at birth currently is around 950 or something. So there are 950. That's right. So 952 girls per 1,000 boys, right? It has improved slightly over the years, but that's what broadly it is. The sex ratio has improved, no doubt. Sex ratio has improved because of the laws such as anti-abortion laws, awareness against female infanticide, strict laws against female infanticide, women education, women empowerment. So there is absolutely no doubt that the sex ratio would have increased. But has that sex ratio become
positive towards
women is something that is that still is highly debatable.
Okay, so it's not like immediate cause for jubilation, but we need to take we need to celebrate these small wins that we have made through these years, right?
Absolutely.
So the next part of it is about the nutrition. I mean, some areas are seeing better, but a few, key indicator that has actually worsened is the incidence of anemia. Yeah.
And anemia both in children and in women, and that's an area of concern, because if a mother is anemic, then it there are sort of multi-generational, intergenerational sort of thing, because that will impact the child also, and so that's an area of concern, because the anemia levels are really very high. Although there are sort of government schemes and policies in which iron or IFA tablets, they have been distributed to pregnant women, but it has not. Something has gone wrong, because somehow anemia levels have gone up. Also, one important sort of aspect that should be learned from from the present NFHS report is that diversity in diets is also extremely important. And homogenizing or having a I would say homogenizing. So homogenizing a food policy and having a one size fits all is not going to work. As per the region, as per the geography, we have to see what local diets or what local staple food the communities are consuming, and we have to make sure that they consume a holistic food rather than a standardized kind of a food. Yes, a standardized top-downish kind of an approach we shouldn't have when it comes to diet related policies. As I said, the prevalence of malnutrition has also gone up. Although, as I said earlier, that in phase one, the prevalence were quite high, but in phase two, somehow the prevalence is quite low. So that's maybe a methodological error, as Ashwini Deshpande argues in her piece. But that's something which is really very, I would say, alarming. Yeah. Because the health indicators, as I said, because there are other indicators and other surveys also, the health indicators are improving, but our nutritional indicators are worsening. That's something which is quite paradoxical as well, and something that a policymaker should make a note of it.
Yeah, and also of late, I mean, we had heard that there is a policy that they're trying to replicate what they did with iodine when it comes to anemia and iron, so fortification, etc. We have done a previous episode, not me, but there is a previous ATP episode where we are cautioning against going whole hog with fortification, because anemia is a different problem to deal with than with iodine. So we can't this requires detailed thought. It requires engaging with all stakeholders and at the very grassroots level. So I think that task is cut out for policymakers to improve the nutrition levels in the country, right? So the last part of this study or this survey as such is the increase in cesarean births that are being seen across. Okay, one data point points us to this, that 47.5 births in private health facilities are by C-section. Now that could be, that is alarming in the sense that, that is a huge number. But how should one read this, in public health or in, any other form? What kind of analysis can we bring to this?
Right. So Suman, I think again, it has two sort of dimension, two aspects. One is a natural thing that maybe some private providers are getting indulged in malpractices, and even though it's a normal delivery, just to make money or just to sort of bloat the bills and the invoices, they are insisting on having cesareans. And so that's a very simplistic sort of a reason. Another reason, and it's also a quite well researched reason, could be because of health insurance schemes. Because a C-section comes under some of the health insurance schemes, especially earlier Andhra Pradesh used to have health insurance schemes, and they were high prevalence of C-section thing. And then when they started probing, they realized that because of health insurance, the care providers, the doctors or the clinics or the hospitals, they would insist that they have C-section so that they can foot more bill, because normal delivery won't foot that much kind of a bill, right? So there's obviously there's a correlation. There is some data as well in the public domain in several research studies that kind of relates C-section, increase in C-sections in India or in some states with increase in health insurance scheme. And that's where I've argued elsewhere also that there has to be some sort of a check and balance within health insurance thing. There has to be an ombudsman, or there has to be some sort of a regulatory thing that doesn't allow or disincentivize malpractices such as these, right? So that would be one of the reasons. Yes.
Okay. The other thing I was looking at was also, maybe we are just jumping to a conclusion. Maybe if maternal mortality rates are better now, it could be because of the C-sections, because, if the safety of a delivery is increasing because of the C-section, the maternal mortality will come down and stuff like that. So there could be some, it's kind of a gray area, because you can't really say all C-sections are unnecessary. You can't also say that, okay, you can't rule out the high, prevalence of malpractice. So it is something that, we need to investigate further. Right?
That's right.
Yeah. So, on that note, I think we should close this episode. I hope the listeners got a good overview of what the NFHS means. And anybody who's interested in positive health outcomes in this country, I think should track this closer. So with that, we'll close this episode. Thank you for listening. Thank you, Apurva.
Thank you, Suman. It was great talking to you.
Same here.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
Have you ever wondered where the business world is headed? How the ways in which we create, market and sell to consumers will evolve? Or if we'll ever go back to wearing pants while working? For answers to all of this and more, tune into Advertising is Dead with me, Varun Dugirala. Every Tuesday, as I talk to entrepreneurs, leaders and change makers from across business, media, marketing and beyond. You can catch all episodes of Advertising is Dead on the IVM Podcast website, app or wherever you get your podcast from.
Do you like true crime stories? Do you like to learn about the people behind some horrible, awful crimes?
More specifically, women that may have committed these crimes.
Actually, Indian criminals that are women?
Then we'd like to welcome you to our podcast, Misconduct. My name is Raghavi.
And I am Nisha.
We cover themes like murder, dacoity, drug trafficking, financial fraud, kidnapping, and many more.
You can catch us every Wednesday on the IVM Podcast Network or wherever you get your podcast.